Hi everyone, stomach acid part 2. So the last video I produced we talked about that very unpleasant subject, vomiting, and the impact that it has on your teeth. What I want to talk about today is a far more insidious, subtle, and frankly very difficult to detect problem, which is acid reflux, otherwise known or part of the symptom of the condition called gastroesophageal reflux disorder. Never forget the D, the disorder. So in this condition, for reasons that we don't entirely understand, the acid contents of the stomach come up the esophagus and into the back of the throat and into the mouth. It's an incredibly unpleasant condition. If anyone has experienced it, you'll know what I mean. The stomach is designed to cope with acid. It's an incredible organ, amazing structure, that it's soft tissue, and yet it can hold hydrochloric acid, which is really one of the strongest acids we know, pH of 1. It's designed to break down protein. And the stomach is made of protein, yet it doesn't break down with its own acid. That's quite remarkable. The problem is very few other tissues in the body can withstand acid. The esophagus, the delicate tube that connects your mouth to your stomach, it also can't tolerate acid. And for many people, they will experience symptoms. If they have acid reflux, they will experience symptoms of a burning sensation, sometimes central chest pain, so they occasionally can mistake it for a heart attack. It can be so severe. For other people, they feel the acidity in the back of their throat and it produces a horrible sour taste and a burning sensation. It can damage the vocal cords and give you a hoarse, raspy voice from the acid damage. And of course, for my role as a dentist, we see it impacting incredibly badly on teeth. And of course, again, we've got the problem with that acid. But what it tends to do, if the acid is coming up, it tends to pull around the teeth. So it just sits around the teeth and exerts a very bad effect on them by the acid just eating into the tooth surfaces. And of course, one of the problems is tooth sensitivity. Okay, that's fine for the people who have symptoms, the people who have the burning pain or have the sour taste at the back of their mouth. The problem is a substantial number of people don't have any symptoms at all. And so the condition is called silent reflux. Now, sometimes the people who pick up your silent reflux are actually the dentist, strangely enough. Because, as I said to you, with that reflux and the fact that the acid is just sitting in the mouth, what you tend to see is a lot of damage around the molar teeth, not so much the front teeth, unless it's very bad indeed. And you often see it on the inside surfaces of the upper teeth, and the teeth can actually get eaten away where the surface goes from being, tooth surface goes from being slightly convex. If there's enough acid erosion, the tooth can actually become concave as the acid over years and years eats into the surfaces of the teeth. So, isn't that interesting that sometimes you go to the dentist and the dentist is the person that asks you the question, hey, do you have reflux? Is it possible that you have heartburn? I still have a lot of people that I ask the question and they say, no, they don't have reflux and they've never had a problem with that in their life. Okay, so that leaves us with a little bit of a dilemma. I'll talk more about that in a moment. One of the other problems with reflux, and particularly with silent reflux, is that it can happen when you're asleep. So, that's that's a dilemma. I mean, I often joke to my patients that I'll come and visit them at 3 a.m. with a piece of litmus paper and put it in their mouth to test whether they've got stomach acid. It is a joke. It's a bad joke, but, it's a dentist joke. What are you going to expect? But what we need to do is understand that this is a very interesting condition, and one that needs more, of course, than your dentist to manage, because all we can do is point out that you've got indicators and signs you might have this condition. The next step is for you to then go on to your GP and talk to them about the potential that you have this condition and then what you do to manage it. So what do you do if you know you've got reflux, or if you're suspicious that you've got reflux and you're getting sensitive teeth? I find this a challenging condition to treat. And so one of the things I encourage people to do is to look at various lifestyle factors to take a little better care of that stomach before you put it to bed. Now, what I mean by that is that sometimes we're a little bit brutal with our stomach, and I know that I certainly have been and will continue to be. Sometimes we eat too much and eat too heavy and eat too late at night. A lot of people are so busy, and the practice I work in, quite a few people will be eating their main dinner, their meal, at 9:30, 9:45 at night, not long before they're ready to go to bed. Okay, that's fine if it's the only thing that fits into your timetable, but remember, this body has a rhythm, its own rhythm, and it's a rhythm that's actually in sync with daylight hours, with nighttime, and with the basically the rhythm that the planet is in. Our body is very harmonious to that. Unfortunately, human life and business and the work life we've created is not really harmonious to anything very much. And so people are placed in a position where their body would really like to eat a meal probably 3 or 4 hours earlier than that. So you're going to bed when the body is winding itself down, and it's not really wanting to be in the activity of digesting food, yet we're giving it a big stomach full of food to digest. So what I encourage people to do who have reflux or may have reflux is to start to look at rearranging your life a little bit. Experiment with eating perhaps a main meal for lunch if an early dinner is just not going to happen. The other thing I try to encourage people to do is not eat in front of the computer. And I can put both hands up for eating in front of the computer and typing away and doing work. I mean, I've done it, and when there are deadlines, it's easy to do. Problem is, digestion relies on what we call the parasympathetic nervous system, the steady, the very calm, the relaxed nervous system. And the problem is that sometimes when we're working, we can be quite intense, and we can actually be triggering the opposite of the parasympathetic nervous system, which is the sympathetic nervous system, but it's also the fright, fight, flight reaction. So your body in digesting food needs to be settled. It doesn't want to be asleep, but it wants to be settled, and we're unsettling it by being a little bit agitated. Even if you think you're not agitated, and even if you think you're calm, sorry folks, I have to say that's not the level of calm that the parasympathetic nervous system wants to really digest food properly. So consider these things. The other thing I do suggest people do is not drink alcohol with their evening meal. So I need something to protect me from the arrows that are going to be shot at me for that one. Everyone has this belief, or there's this thing that wine helps you digest food and it's acidic and so it's good for you, and antioxidants and whatever else we talk about with alcohol. The problem with alcohol is that it's going to increase that tendency towards reflux. And and I'd put vinegar in the same basket, to have if you have a lot of vinegar on your salads, it's a lot of acid that you're putting into an already overly acidic situation. I don't feel that that's a particularly helpful thing to do. What we really want to do, and the way I always look at these things, is very often when our body presents us with unpleasant symptoms like a burning sensation or discomfort after we eat, what we want to do, our first impulse as human beings, is say to our body, shut up, I'm not interested. And we try and suppress it. We want the symptoms to go away so we can go on doing what we do. And what I have learned slowly over many years and from my own experience is I'm actually learning to welcome those symptoms, because they're telling me that something about the way I'm doing what I'm doing is not working. And am I willing to be honest? It's rough. It really isn't easy, and I've had some experiences myself where I've really had to look at what I'm doing and how I'm running my body. And sometimes I'm running my body in a way that's, if there was a manufacturer's warranty, I would have voided the warranty. So, what am I talking about? Reflux. If you don't think you've got reflux, but you're getting very sensitive teeth at the back, again, you know what I'm going to say, talk to your dentist. In terms of what we can do, sometimes what we recommend is, rinsing your mouth with bicarb soda before you go to bed. Okay, it's not going to do a lot, but you're at least creating an alkaline environment to combat the acidity that's coming. Sometimes when people have very severe erosion, what I do is I actually put a coating on the surfaces of the teeth of a material that is extremely neutral, a very benign material, and it washes away. The acid actually eats it away. But that's fine. I actually quite like that. Eat that away. I don't mind. And we just replace it in a year or two's time. But while that material is there, it's stopping your teeth from being eaten away. By all means, as I said, you need to talk to your doctor. Do you go on one of the protein pump inhibitors, the medications that suppress acidity? You need to talk to your doctor about that. Do you do further investigations? Sometimes when acid erosion is very severe, and I'll give you one example. I saw a very young man. He was in his early 20s, and he had profound damage. He had actually lost almost all of the enamel on his back teeth. That's extremely alarming in a very young person. When I questioned him on soft drink, vinegar, lemon juice, no to all of those. He wasn't drinking fruit juice. He didn't eat a lot of fruit. I said to him, you need to go to your doctor. Turns out he had the microorganism that causes stomach ulcers. So that needed to be properly investigated, which he did. So I will leave that to a conversation between you and your GP. I never suggest neglecting these things. If you're getting reflux, or as I said, you're getting extremely sensitive back teeth and your dentist thinks maybe you have reflux, please at least go and talk to your general practitioner about it, because sometimes there can be more serious underlying conditions that we don't want to ignore. If something's not right in our body, we need to know, because when we know, we can actually take the steps. However, those lifestyle tips that I gave earlier, they are still worth considering. Even if you need medical treatment, there is no harm in being far more respectful to when and how you feed your body. There is nothing wrong with perhaps even making adjustments to your diet to think, are there foods where that upsets me and I do get reflux? A big one for me was pizza. I loved pizza. And I did not want to give my pizza up, but I had to, because I would eat the pizza and then I'd go to bed and have a night of absolute hell with acid running up my esophagus and burning the back of my throat. So, goodbye pizza. But I sleep well and I don't have reflux anymore. So, I think it actually ends up being a win-win situation. So always post questions, challenge me, and please feel free to jump on my YouTube channel and share my posts, because I think the more people get to know about this, the more we start to understand how, not only how important our mouth is, but how much we can do to really look after it. But then the bigger picture, you look after it, you're starting to take care of all of your body. Anyway, lovely speaking to you. I hope this was of value. Thanks, everyone. Bye.